On the 10th of March 2025, we at Moatfield Surgery will be launching our new appointments and access system, changing the way we book appointments and how patients access our services. My name's Emily, I'm the IT and Data Manager at Moatfield Surgery, and I'm going to be answering some of the most asked questions about our new system.
I can't use the online form and I don't have access to the internet. How will I book an appointment under the new system?
We're introducing this system to give more ways for patients to book appointments, not less. If you don't have access to the internet or are struggling to complete the form, you can still call our team on the main surgery number. They'll ask you the questions over the phone that you would have filled out on the form. Alternatively, we will have a booking kiosk in reception, so you can pop down to the surgery and submit your form that way.
Will there be any privacy when using the triage form kiosks in reception?
We understand you don't want to feel watched while submitting your medical request. That's why we will be positioning our booking kiosk, which will contain 2 tablets for patients to submit their requests, in a private area of reception.
If my problem is not that urgent, will the system show me appointments later in the week? Otherwise, people might always choose today.
As you fill in the form and complete the pathway, Rapid Health is assessing how urgent the issue is. Based on the urgency of your problem, it will show you appointments for today, the next 2 to 3 days, this week, or up to a month ahead. This is why it's important to answer the questions honestly, because it means that we will have a better understanding of how urgent your issue is.
What happens if I have more than one problem I need attention for?
As with our current system, you will need 1 appointment per medical request. This means if you have 2 different issues that you would like to address, you will need to complete 2 forms. Each request is assessed individually, so while you may need to see a GP for one issue, you may be booked in with another member of our team for your second request.
How long will it take to receive a response when my request is triaged?
Once you've completed your form, Rapid Health will let you know that you can expect a response within 48 hours, but we will very much be looking to respond the same day that your request comes in, depending on the urgency. It is important to stress that you should not be using Rapid Health to submit requests about matters that should be dealt with by A&E or by dialing 999, such as a heart attack or a stroke.
Will the triage team have access to my records?
Yes, the triage team will be made up of our GPs and our patient services team. As employees at the practice, they will have access to your medical records. This will enable them to triage you more effectively and process your requests better.
Will appointments still be offered at the pharmacy or other local services?
By using Rapid Health, in conjunction with changing our appointment system, we will be able to make better use of the additional capacity at our disposal. This means, when appropriate, we may redirect you to other services, such as the local minor injuries unit at the Queen Victoria Hospital and the Pharmacy First referral scheme.
How will I book nurse appointments under the new system?
The way you access many of our services will remain as they were before. If you need to book in with a nurse or would like a blood test, wound care or similar activities, you will need to call the practice to arrange this. The same goes for accessing your test results. You can call our team or look on your NHS app.
When the NHS app is integrated, will I need an NHS account in order to access the triage form?
The Rapid Health form will soon be available from your NHS app, but this doesn't mean you have to have an NHS app account to use it. The link will still be on our website, and you do not need to register to use this service, so it is entirely personal choice how you would prefer to access the form. If you would like to register for the NHS app, our website will show you everything you need to know.
Is this system being used at other surgeries in the UK? If so, how are you learning from other practices who have already gone live with the system?
Rapid Health is used by practices across the country, including our neighbours at Modality Mid Sussex. We didn't make this decision lightly. We did our research by booking demonstrations with multiple providers, reaching out to other practice managers and even visiting other practices to see how their system was working for their patients and staff. We've learned from lots of other practices, including practices who've chosen different systems and providers. From this, we learned that we didn't want to add a basic form to our existing appointment system without making changes to the way we work as well. This would just create an overwhelming additional stream of requests that would be difficult to manage. We also learned that rushing a process such as this can have a real negative impact on different patient groups. We've had conversations with Healthwatch West Sussex and other independent organisations to discuss our plans. We don't just want to tick a contractual box. We want to ensure that the changes we make will only have a positive impact on our patient population.
Why will this work better with no increase in medical staffing at the practice?
By completing the form, we will have a better idea of the problem you're contacting us about, and a clearer picture of where that request should go. This means that although we won't have any increased capacity, as we're not hiring any additional GPs, we will be making better use of the capacity we do have.
After the launch, will there be a review period?
This system will be in constant review. As time goes on, we will learn more about our capacity and demand, and we'll be making changes to ensure that we are meeting that demand as best we can. Throughout the process, we will be gathering your feedback, so make sure you head to our website to submit your thoughts. I hope this has helped to answer some of your pressing questions about our new system, but if you do have further questions about how the new process will work, recordings from our live demonstration sessions can be found on our website and our YouTube channel. To stay up to date on all the latest going on at Moatfield Surgery, please be sure to follow us on our social media pages. You can find us on Facebook and X. And please submit your feedback either by using the form on our website or the feedback slips that can be found at reception.